Okay, so the first procedure is to review the physician's order for oxygen to ensure that it includes method of delivery, flow rate, and irritation rate. Second is to perform hand hygiene. Next is to identify the patient. Okay, ma'am, what's your name po? How old are you?
49 years old.
Okay, Glenda Balisa, 49 years old. After that, I'm just going to close the doors and the windows for your privacy. Okay. I'm going to proceed to the sixth right of the medication administration. Okay, so you have six right for medication administration. Right patient, right medication, right dose, right time, right route, then right documentation. Then let's explain to the patient that oxygen will ease dyspnea or discomfort and inform the patient concerning safety precautions associated with oxygen use. So if the patient is using cannula, encourage him or her to breathe through nose. So mamaya po, gagamit tayo ng nasal cannula. I want you to breathe po gamit ang iyong nose. Okay? So, I will assist you, ma'am, to the high foulers. Ito po. Okay, so my patient is in the semi-Fowler's position. After that is we're going to insert flow meter into the wall outlet, then attach oxygen tubing to the nozzle on flow meter. If using a high oxygen flow, attach humidifier, attach oxygen tubing for humidifier. So we are going to turn on the oxygen at the prescribed rate, then we are going to check if the oxygen is flowing through that tubing. So we have here our tank. So our tank is where the oxygen is restored. We have our humidifier to prevent nasal cavity being dry if it humidifies the flow of the oxygen. For the nasal cannula, first we are going to hold the nasal cannula in proper position with the prongs facing or curving downward. Then after that, we are going to place cannula prongs into the ears of the patient. Okay. Then we are going to wrap the tubing behind the patient's ears. Fix it. Then after that, we are going to adjust plastic slide under the chin until the cannula fits snugly to the patient. Next is to place gauze at ear beneath tubing as necessary. After that, if prongs are dislodged from the ears, replace promptly. Okay, so we're done using the nasal cannula to the patient. When using a mask for oxygen for the patient, first is we are going to place mask on the face of the patient, applying from the nose and over the chin. Then we are going to adjust the metal rim over the nose and contour the mask to the face. Then after that, we are going to adjust elastic band around the head so the mask fits snugly to the patient. Okay, so we're done. After performing the nasal cannula and using the mask to the patient, we're going to assess for proper functioning of the equipments, and we're going to observe patient's initial response to the therapy, whether it is good to the patient or it caused bad effect to the patient. Then we're going to monitor continuous therapy by assessing the pressure areas on the skin and ears every 2 hours, and we're checking flow rate every 4 to 8 hours. Then we're going to document patient's response to the oxygen therapy or the nasal cannula therapy. Then we're going to refer to the physician if we can observe abnormal findings throughout the procedure or after doing the nasal cannula and mask to the patient. Then we're going to perform the aftercare.